Welcome back to Silver Vitality Vault, your premier digital sanctuary for health advocacy, longevity, and the unvarnished truth about aging gracefully in a world of over-medicalization. Today, we are opening the vault to a hidden reality that most seniors will never hear within the sterile walls of their doctor's office. Every year, millions of vibrant adults over the age of 70 line up for their annual checkups, fueled by the virtuous belief that they are taking the necessary steps to stay safe and healthy. But what if the very tests you trust, the ones your clinic insists are routine, are actually the catalysts pushing you closer to unnecessary surgery, life-altering strokes, or even a cancer diagnosis? Startling new data indicates that as many as 37% of medical screenings performed on seniors lead directly to avoidable treatments, debilitating complications, or permanent side effects. Perhaps most shockingly, 99% of people in our age bracket remain completely unaware that they are being subjected to over-testing, a phenomenon where the search for problems creates more harm than the problems themselves. One specific checkup on our list today is so controversial that it is linked to 5% of all cancer cases in the United States, a risk factor equivalent to consuming alcohol every single day. You won't find this information on a hospital billboard or in a pharmaceutical pamphlet. The truth is buried deep within peer-reviewed journals and clinical trials, and today at Silver Vitality Vault, we are bringing it into the light. We are counting down the 5 health checkups you should avoid after 70 and revealing the terrifying reality of what they can do to your body. Wait until you see what we've placed at number 2. It is a procedure so common that you've likely been pressured to get it multiple times. Before we begin this critical discussion, please join our community in the comments. Where are you watching from today? What is your age? And have you ever personally regretted a medical test or procedure that felt unnecessary? We are reading and replying to every single member of the Silver Vitality Vault family with personalized insights. Don't forget to like this video and subscribe to help us reach more seniors with this life-saving information. Now let us begin with number 5. Number 5, the osteoporosis trap, bone density scans DEXA. We start our list with a test that appears perfectly harmless on the surface, the bone density scan or DEXA scan. It is a quick, painless procedure with no needles and no prep. You walk in, lie down, and walk out believing you now have a score that determines the future of your mobility. But for those of us over 70, this scan can often be an architect of unnecessary fear rather than a tool for health. The primary function of a DEXA scan is to detect osteoporosis, but here is the biological catch. Bone density loss is a natural physiological part of the aging process. Just like the appearance of silver in your hair or the softening of your skin, your bones naturally become less dense over time. When a senior woman takes this test, the results almost inevitably show lower density because the software is often comparing her bones to those of a 30-year-old. This leads to millions of seniors being pushed into taking bone-building medications like bisphosphonates. While these drugs are marketed as a shield against fractures, they carry a dark side that many clinicians gloss over. Bisphosphonates are linked to jaw necrosis, a horrific condition where the jawbone literally begins to die, as well as severe esophageal inflammation and atypical fractures where the bone becomes so brittle it breaks in unnatural ways. A study in the Journal of the American Geriatric Society found that for women over 70, these medications reduced fracture risk by a measly 0.3% over 5 years. This is a statistically insignificant benefit compared to the very real risk of debilitating side effects. The Silver Vitality Vault perspective. Take the case of Rose, a 76-year-old piano teacher and a regular member of the Silver Vitality Vault community. Rose walked daily and felt strong, but a routine DEXA scan labeled her with osteopenia, a mild density loss that isn't even a disease. She was immediately prescribed alendronate. Within months, she was suffering from such severe reflux and jaw pain that she had to stop playing her piano. We helped her transition toward a lifestyle-first approach, vitamin D optimization, resistance band training, and a calcium-rich diet featuring sardines and leafy greens. Today, Rose is back at her recitals, enjoying better balance and zero fractures, all without the toxic burden of unnecessary pills. For seniors who aren't experiencing frequent falls, lifestyle interventions have been shown to be 20% more effective than drugs in preventing real-world injury. Number 4, the fear generator, brain MRI for mild memory loss. Number 4 involves a test that preys on our deepest fears, the brain MRI for memory loss. When we misplace our keys or forget a neighbor's name, the specter of Alzheimer's or dementia begins to loom. Doctors, often acting out of defensive medicine, will order a brain MRI to be safe. However, the uncomfortable truth is that an MRI rarely provides the clarity you are seeking. In a person over 70, a brain MRI will almost always show age-related changes. These might be described as white matter spots or slight shrinkage. While these terms sound terrifying on a lab report, they are often as normal as a wrinkle on your forehead. The danger lies in what happens next. Once a spot is found, it triggers a cascade of anxiety, follow-up scans, and in some cases, exploratory surgeries or spinal taps that do absolutely nothing to improve your memory. A 2021 study published in Neurology Today reviewed 3,000 MRIs for seniors with mild memory complaints. While 86% showed an abnormality, only 3% of those findings were actually linked to a treatable medical condition. This means 97% of those seniors were subjected to unnecessary psychological trauma. The Silver Vitality Vault perspective. Consider George, a 74-year-old retired engineer. George was sharp, but like many of us, he was occasionally forgetful. His MRI showed white matter changes, and he spiraled into a deep depression, convinced his life was over. He stopped driving and withdrew from his community. When we reassessed him using a simple paper-based cognitive screening, which evaluates problem-solving and attention, his scores were perfectly normal. George didn't have a brain disease. He had a fear disease, triggered by an unnecessary scan. At Silver Vitality Vault, we recommend that unless you are experiencing seizures or rapid personality shifts, start with a cognitive screening first. It is cheap, effective, and avoids the scare tactic results of an MRI. Number 3, the heart alarm, cardiac stress tests. Moving to number 3, we find the cardiac stress test. This is frequently ordered for seniors who mention feeling a little more tired than usual or experiencing slight chest tightness. The test, which involves walking on a treadmill while hooked to an EKG, is meant to find blocked arteries. But after 70, the false alarm rate for this test is as high as 40%. A false positive on a stress test isn't just a minor error. It is a gateway to invasive heart procedures like angiograms, stent placements, or even bypass surgeries that carry significant risks. A major 2017 study in JAMA Cardiology revealed that more than half of all stents placed after a stress test referral were performed on patients who had no actual symptoms and received zero benefit in terms of longevity or quality of life. What these patients did receive were higher rates of internal bleeding and kidney injury from the contrast dyes used during the procedures. The Silver Vitality Vault perspective. Raymond, a 75-year-old retired postman, is a cautionary tale for the Silver Vitality Vault community. Raymond mentioned feeling winded on steep hills, so his doctor ordered a stress test. The result was vague, leading to a heart catheterization. They found a tiny narrowing, common in a 65-year-old heart, and placed that night, Raymond's kidneys began to fail due to the contrast dye used in the procedure. He spent a week in the hospital and never actually felt less tired, because his fatigue wasn't a heart issue, it was a hydration and rest issue. If you aren't having chest pain at rest or severe shortness of breath, a resting EKG or a low-radiation coronary calcium scan is a much safer way to assess your heart health. Number 2, the colonoscopy pipeline. Screening after 75. Number 2 on our list is perhaps the most controversial, the routine colonoscopy for those over 75. While we've been told for decades that this is the gold standard of cancer prevention, the risks for a senior often far outweigh the rewards. The preparation alone is brutal. Powerful laxatives can cause severe dehydration, fainting, and kidney strain in an older body. Furthermore, the sedation used during the procedure poses a significant risk to the aging brain, sometimes leading to post-operative delirium or long-term cognitive fog. A 2019 study in JAMA Internal Medicine involving 1.3 million Medicare patients found that for every 1,000 colonoscopies performed on patients over 75, only 2 lives were saved, while over 20 people suffered serious complications like bowel perforations or heart rhythm disturbances. The Silver Vitality Vault perspective. Dina, a 73-year-old grandmother and bakery owner, had no symptoms and a clean medical history. Yet her doctor pushed for a routine screening. During the removal of a tiny, slow-growing polyp, her bowel was perforated. Dina spent 9 days in the hospital, lost 10 pounds of vital muscle mass, and has never regained her previous energy levels. She had already had 2 clean scans in the past. There was no biological reason to repeat the procedure. At Silver Vitality Vault, we remind our viewers that major health task forces recommend stopping routine screenings at 75. A non-invasive fit test done at home is a much safer, prep-free alternative that still catches the majority of concerning cases. Number 1. The radiation overload. Annual full-body CT scans. Finally, we reach the number 1 most dangerous checkup for seniors, the annual full-body CT scan. These are often marketed as executive health packages or peace-of-mind screenings in private clinics. They claim to catch everything early. But the reality is that these scans are a landmine detector that often blows up in your face. A single full-body CT scan delivers a massive dose of ionizing radiation, equivalent to roughly 500 chest X-rays. A 2023 study in JAMA Internal Medicine suggests that the rise of these unnecessary scans may now be responsible for 5% of all cancer cases in the United States. It is a staggering irony. The test you take to find cancer may actually be the thing that causes it. Beyond the radiation, these scans find incidentalomas, tiny harmless cysts or nodules that are simply part of a body that has lived 7 decades. But once they are seen, you are on a one-way train to biopsies, PET scans, and surgeries. The Silver Vitality Vault perspective. Marcus, an 80-year-old martial arts instructor, felt fantastic until he took a full-body scan just to see. It found a tiny 3mm nodule on his lung. This set off a 2-month chain reaction of oncology visits and a needle biopsy. The nodule was benign, but the biopsy collapsed Marcus's lung, leaving him hospitalized and unable to teach for months. He traded his health for information that he never needed. The American College of Radiology is clear. These scans should never be used on people without specific symptoms. Real prevention at Silver Vitality Vault means listening to your body, not looking for trouble in a machine. The Silver Vitality Vault promise. Modern medicine is a miracle, but it is not a religion, and more is not always better. Your time, your energy, and your physical integrity are far too valuable to be wasted on fear-driven screenings that lead to a diminished quality of life. At Silver Vitality Vault, we believe the most powerful diagnostic tool you own is your own intuition and a healthy lifestyle. Stay active, eat real food, sleep deeply, and choose your checkups with the wisdom that only comes with age. We want to hear from you. Have you or a loved one ever faced a medical nightmare because of a routine test that went wrong? What did you learn from that experience? Please share your story in the comments below. Your words could be the warning another senior needs to hear today. If you found this information eye-opening, please hit that like button and share this video with your friends and family. Subscribe to Silver Vitality Vault to stay informed and empowered. Thank you for watching, stay vital, and we will see you in the next video.